Coming to you live from Washington State University, I'm Brian Fantana.
And I'm Ron Burgundy.
Today we will be discussing the current laws and policies that protect individuals from being negatively impacted by genomic testing, focusing on the laws that are currently in place that protect individuals from discrimination with insurance or employers. Also on laws that limit genomic testing and research.
Since genomics is growing exponentially in our world today, it is important for healthcare professionals to be aware of complications and benefits to genomic testing and research. Being able to use genomic research to help patients and prevent the misuse of new genetic technologies and information is trivial.
Why is legislation needed, you ask? Let's close the gap in knowledge. Here are a few points stating why legislation was signed to help protect nurses and patients. Based on genetic information, employers were trying to avoid hiring workers that they believed would take more sick leaves, resign, or retire early due to health reasons. Insurers can still use genetic information in the individual market to discuss or to make decisions about coverage, enrollment, and premiums. Penalties in HIPAA for discrimination and disclosure violations should be strengthened in order to ensure individuals of the protection afforded by legislation.
Genetic testing also will help doctors catch problems early, perhaps leading to preventative treatment and lower costs. Also, to protect ourselves as nurses. We all know HIPAA.
Yes, and that is where we will begin. HIPAA, the Health Insurance Portability and Accountability Act, was enacted by the United States Congress and signed by President Bill Clinton in 1996. HIPAA is extremely strict and highly enforced to protect patient security. In simplest terms, HIPAA addresses the security and privacy of health data.
In the state level, there are two laws that have been passed: the Privacy and Research Issues and Employment Non-Discrimination.
We will start with the Employment Non-Discrimination. In our RCW, Washington State states that person, firm, corporation, or the state of Washington may not require an employee to submit genetic information or genetic screening. This protects an individual from being discriminated against a genetic test result, benefiting the future health status of our health, state, and country.
RCW Privacy Issues, Research Issues. In Washington State, a healthcare provider may not disclose healthcare information, including a patient's DNA, about a patient to any other person without that patient's written authorization, even with research data. Like HIPAA, protects the patient from discrimination and other negative outcomes from this information being disclosed.
On top of that Washington State laws, GINA was signed in May 2008. GINA protects Americans from being discriminated based on information derived from genetic tests. It forbids insurance companies from discriminating. In addition, insurers and employers are not allowed to, under law, to request or demand genetic testing in a national level.
And research is expanding in personalized medicine, direct-to-consumer marketing of genetic tests, genetic testing and counseling, informed consent, fairness in the use of genetic information, and privacy and confidentiality of genetic information.
Also, psychological impact and stigmatization due to individuals' genetic differences, reproductive issues including adequate informed consent for complex and potentially controversial procedures, clinical issues including the education of doctors, other health service providers, patients, and the general public, uncertainties associated with gene testing for susceptibilities and complex conditions such as heart disease that are linked to multiple genes and gene-environment interactions.
The ELSI research program supports examinations and investigations of ethical, legal, and social implications of genetic research. ELSI seeks to inform the development of policies and programs to address those implications in order to maximize benefits of scientific research while minimizing the potential of social, personal, and psychological harm. Established in 1990, the ELSI research program is currently the largest supporter of medical ethics research in the federal government.
Wow! In addition, the scarcity of genetic specialists relative to the potential demand for genetic testing, there are other reasons why other professionals should be involved in genetic testing. First, few people have sufficient understanding of genetics and to recognize whether they or their children have an increased risk for inherited diseases. Therefore, healthcare professionals who provide care to most people have the responsibility to determine whether they are at a high-risk situation. Second, healthcare providers and nurses who visit periodically are in the excellent position to elicit this risk. Once the risk is known, non-genetic professionals should be able to point someone in the right direction for genetic testing.
Thank you, Brian. And in summary, laws and regulations protect our patients from being discriminated and violated. Laws such as HIPAA and GINA protect our patients' information, including genetic testing. Insurance companies or employers cannot request genetic testing to change policies or hiring. Genetic testing is expanding greatly. We must be the ones to learn about these laws and restrictions in order to successfully protect and care for our patients. Legality may not be the most fun to learn about, but it is important in caring for our patients and learning and protecting yourselves from violations.
Thanks for listening.
Stay classy.
And here's our references.
551!